So we have a great opportunity as young dentists to look at the landscape and to develop who we are as it pertains to that landscape. What do we want to be? Do we want to be stay at home? Do we want to go out there and rule the world? We have to look in the mirror and know ourselves, because owners will own, followers will follow. There's nothing wrong with either one, but you must pick the right one. Finance, growth, education, ability to practice, staff. Make sure you are the commodity in your mind and you make the decision on what you want to do with your career, because it's your career. Hi, everybody. Welcome to Dentistry Beyond the Numbers. I'm Dr. Marc Liechtung. So happy to be back talking about dentistry and everything that can help us be better. Today's topic is one of tremendous interest. It is really the question doctors, young doctors, pre-graduation doctors, post-graduation doctors, and doctors entering the middle of their career. What's the direction I want to go? Group, private, specialty, non-specialty. It is amazing. 26% of dentists who are 3 years and under are somehow affiliated with corporate dentistry. And what's really amazing and really shocked me is almost 37% of dentists under 20 years of experience, 20 years and under, are affiliated with some form of group or organized DSO, DPO type of dentistry. Dental groups, and we know it, they're growing and here for good. So the exciting part is we either get to know it or be left out of it. I'm here to guide you, and we're going to get into what that means. That is not something that I'm telling you what to do, because I can't. When I was running my practices and building up my groups, I was lucky enough to be affiliated with 3 DSOs, 3 groups that bought my practices. And my experience with them, although positive, wasn't the best financial outcome when they went to sell or they tried to raise money. It just wasn't the time for groups back then. Although my last experience has been very good, and I look forward to a fantastic end or a fantastic result. But what I saw was it's not for everybody. And these are the questions people have to ask. The dental student that I met at a coffee shop was very concerned. He said, Dr. Liechtung, I'm so happy you're here to talk to me, but I don't know if I want to specialize, if I should go into the groups, if I should open my own practice. I said to him, tell me, do you want to be an owner? He said, yes. I said, then you should be. The second group was dentists that are out about 5 years. And they're wondering, do I, now that I have the experience, I want to grow my armamentarium, I want to get to be either my own boss, or I want to get in with a group that really can allow me to really expand my procedure levels, expand my growth, and allow me to keep growing. Those are the questions that are out there. Those are the questions that we're really trying to answer. Right? So the question becomes, what direction should I go? In the last several weeks, I was lucky enough to have and start interviewing 2 doctors for potential jobs. One doctor came in and I said, tell me about yourself, Doc. What are you looking for? He said, doctor, I want to have the religious life. And I know that it'll bite into my schedule when I can arrive and when I can leave. Certain days I need off. But I know that I'm a very good dentist, but that's the way I want to live. I said, fantastic. And then he said, I also want to make $20,000 a year. And I said, great. Do you know if that's gross or net? What percentage are you asking for? Does labs come off? None of these answers did the doctor have. I talked about this before, and I'm going to talk about it again. And that is the financial makeup of what we do for a living is paid on most of the time, unless you're salaried, it's paid on we call it, you eat what you kill. You get a percentage of what you produce, you go home, you get a check, boom. So in the country, in the United States of America, the average dentist is producing about, give or take, $250 an hour. And I have learned through the last several years to break down our life, our working life, by hourly production. At $250, which to me is a doctor who's starting out, doesn't do a lot of the 5 procedures that we talk about, but is a drill, fill, and build type of doctor. At $250, you're grossing about, it's roughly between $150 and $170. Now, that could be wonderful for many of you. If you can get to $700 an hour, either doing implants, crowns, veneers, extractions, whatever you enjoy doing and are good at it, then $700 an hour gives you a production level of $1,450,000, $1,500,000 a year. And that means you're bringing home $500,000. I couldn't figure out what that doctor was saying. I think the people that are looking to grow and know what they want are sort of on a path to grow, and what I mean by that is they are driven to continuing education, to doing the things that they can do to better themselves as a clinician. So I had to ask myself, does this doctor really know what he or she is asking? Or they're just throwing things out that people told them about? So that was something that really was eye-opening for me. I mean, here's a doctor who's asking me for things, but not really understanding if that's his take-home pay or his gross production. The next group that asked questions were doctors out 3 to 5 years. These doctors are a little more inclined to grow, and they want to know where they can grow, where they're going to have the most personal growth, how they can make their most money, where they're going to be received in the future. Where could they make decisions? Do they have to make those decisions? John Maxwell had a quote, and the quote was, "Success was never gained without chronic action and growth." We need to continue to grow as dental professionals, as any professional, but we need to continue to grow and continue to grow with action. Education, mentorship, technology, these are the growing aspects that we can achieve and we can entwine or integrate into our life and our professional careers. That is really an amazing opportunity for us. But in order for us to answer these questions, in order for us to find out who we want to be and what we want to be, we have to ask ourselves, who are we? Are we the person that wants to work really 3 days a week because of his religious life? Or are we a mother or a father that wants to stay home and raise the children? That's great. I'm so envious. I think it's wonderful. I really do. But in all aspects, that is not going to give you that production that you're looking for, that ability to gain. You're going to be very happy with what you make. You're going to be very happy where you are. But my next interview came in and said, "Doctor, I want to be great." And if you want to be great, it takes action. It takes tremendous amount of focus. The next aspect I'm going to discuss is really something you need to know is what aspect, which level, would private practice or would it be group dentistry that would give me the opportunity to do the dentistry that I want to do? I love implants. I love extractions, big cases, veneer cases. I want to grow into those. If I'm in private practice, is this a practice that the doctor is using me to do all the menial work that the doctor doesn't want to do? The bondings, the fillings, the extraction of simple teeth, when they're in another operatory seeing all the bigger cases? When will that be my turn as opposed to a group who are looking for very productive, competent, efficient doctors, just like private practice, where you may not have that block. Once you achieve that level of continuing education in those procedures, they're going to let you do what you need to do and want to do. So be careful when you're looking and weighing both sides. You may find a private practice that the doctor says do everything. Fantastic. That might be your ticket. You might find a group that might say, no, you got to go through 18 months of this and that. Might not be for you. It's a big question. The other question I tell docs to ask, continuing education. Where do I get the best growth? Do I get the best growth with private practice? Do I get the best growth with group practice? Do I have the ability to walk in and really have the courses I want to take laid out for me? In private practice, when I was in private practice, my associates would come in and say, "Doc, I want to take this endo course or the surgical course." And I'd have to weigh it and say, okay, that's great. And then they'd ask me if I would have a program that I would pay for it or chip in for it. And I have to weigh, what value does it bring me? It brings the associate a lot of value. And I wasn't so eager to pay for that if I didn't think it fit into my practice. It's another entity, but we got to ask ourselves on the other side, some of the groups have a curriculum. Some of the private practice, you're dealing with a mentor who's going to give you tremendous education every single day. So these are the avenues that people have to weigh. And you need to ask for it. You need to know. Just like you ask for benefits, you ask for continuing education. You need to know what exactly you're looking for when the time comes that you're looking for this position. Because that position is going to be something you're looking for hopefully a long period of time. And I remember when I was coming out of dental school, out of my fellowship from Penn, I asked myself, what do I want to do? Back then, there were really very little avenues of going into corporate dentistry. That was more hospital-based dentistry, which paid like nothing. So I didn't want to do that. But I asked myself, what do I want to do? Do I want to do high volume or high quality? I thought we could mix the two, but I didn't know which avenue that I really wanted to go. So I worked in two different spots. One was in a mall that had a dental office. It was a big dental office and had a lot of volume and a lot of new patients. Insurance-based, gave me the opportunity to learn a lot about diagnosing, comprehensive treatment planning, give me the ability to work around the mouth. And then I worked in a private practice. I rented a chair. I paid him for the procedures that I would collect money for, a percentage. But I learned from a mentor, and I liked the pace of the private practice. But I learned so much from dealing with patient after patient after patient, would take that back and become so much better for it. I knew what I wanted. I wanted to be an owner of a dental office. I wanted to build a practice. I loved the excitement of the business, the lease, the marketing, the staff, the team, developing, learning. That was me. Back then, there wasn't much of a choice 35 years ago, 30 years ago. Groups were just coming, were being just developing here. And now they're really, as we established early, they are here to stay. So we have a great opportunity as young dentists to look at the landscape, to see what's out there, and to develop really who we are as it pertains to that landscape. What do we want to be? Do we want to be stay at home? Do we want to go out there and rule the world? Do we love the rush? Do we love the degree? We have to look in the mirror, we as clinicians, and know ourselves. Because owners will own, followers will follow. There's nothing wrong with either one. This is a topic that is growing, and it's going to continue to grow as the groups grow. But the myth of the groups being bad, I don't think they're bad. It's a great avenue for young doctors to develop their skills, and like I did, learn their way around the mouth, get continuing education. But you must pick the right one. Because like I went through a few of them, and a couple of them just weren't that good. So please, know who you are, know what you're looking for. These are the things you should be looking for. Finance, growth, education, ability to practice, staff. Make sure you are the commodity in your mind and you make the decision on what you want to do with your career because it's your career. You spent a lot of time getting educated. I wanted to say thank you again for listening to me, for hearing what we discuss and the things that could help you, the clinician, you, the listeners. I want to thank you again. I'm Dr. Marc Liechtung, and I'll see you on Dentistry Beyond the Numbers.